next panelist, Dr. Joy St. John, is the Executive Director of CARPHA, the Caribbean Public Health Agency, since July 2019, where she has led the public health response in the CARICOM region. Dr. St. John was also an Assistant Director General of the World Health Organization from October 2017 to April 2019, with direct responsibility for climate and other determinants of health. She was also the first Barbadian to hold the post of Assistant Director General, and she was also the first Caribbean person to perform the role of Chairman of the Executive Board of the WHO from 2012 to 2013. Dr. St. John is also former Chief Medical Officer of Barbados, the top public health advisor to the Minister of Health, responsible for the oversight of the management of the health sector. So without further ado, please, Dr. St. John.
Thank you very much. I consider it a privilege to speak about how the Caribbean has been responding to this crisis and be part of a panel of such accomplished professionals. I will give you a historical background to set the context of my presentation. The foundation for the CARICOM response began in 1986 with the elaboration of the first iteration of the Caribbean Cooperation in Health. In 1984, the CARICOM Conference of Ministers Responsible for Health accepted the need for a mechanism for health development through increasing collaboration and promoting technical cooperation among countries in the Caribbean. Now in its fourth iteration, CCH has fostered an efficacious level of functional cooperation in the CARICOM region. The next major foundation milestone would be the creation of the Caribbean Public Health CARPHA agency, CARPHA, which I now lead, in 2011 from 5 regional health institutions, which was operationalized as a CARICOM institution in 2013, with an intergovernmental agreement which has a clearly defined public health mandate. The next major foundation was the creation of the Heads of Government approved Regional Cooperation Mechanism for Ebola in 2014, later renamed the Regional Coordination Mechanism for Health Security, which provides a mechanism for coordination of regional action whenever there is a threat to health security. Serendipitously, the previous executive director of CARPHA, Dr. James Hospitalis, spearheaded international development assistance to achieve health system strengthening for health security through the Agence Française de Développement, EU, and the World Bank, which has allowed focused funded foundation support to be ready almost instantaneously when the COVID-19 pandemic was declared. Fast forward to November 2019, when the security cluster of CARICOM decided on the keystone for the ring fence of the foundation, which had been started building in 1986 by raising epidemics to a higher level in the tiers of threats and risks. So on January 4th, 2020, CARPHA alerted the chief medical officers of the region about our concerns regarding this novel virus in China. By the end of January, the security cluster was activated to monitor persons traveling into the region from countries of interest, while CARPHA activated its incident management team. To respond to COVID-19, CARPHA employs a strategy of collaboration with key regional and international partners and experts for coordination through meetings of the Regional Coordination Mechanism for Health Security. Member states and sister public health agencies, including PHE, APS, RIVM, CDC, and PHAC, and PAHO, come together to determine action. The Caribbean Disaster and Emergency Management Agency, CDEMA, links CARPHA and PAHO to the disaster preparedness arm of the security cluster to complete the ring fencing of the CARICOM region by the public health, disaster preparedness, and security arms of the security cluster of CARICOM. But is it enough? Around the world, people are ill and too many are dying. Globally, economies are suffering, not least of which are the economies of the largely tourism-dependent CARICOM states. The people of CARICOM are our greatest resource. Therefore, CARPHA aimed to prevent avoidable illness and death. Like NCDs, CARICOM will not be able to treat its way out of COVID-19, partly because the risk factors for severe COVID-19, the NCDs, are so prevalent. CARPHA has supported the member states through diagnostic testing, protocols, guidelines, and checklists for health and a wide range of sectors, especially the revenue-generating sectors. For example, we are working on the safe return to tourism, and for activities like national general elections and the premier sporting activity, cricket. CARPHA initially provided testing to support to 17 of its 26 member states until they received capacity, and with the support of the air wing of the regional security system, continue to provide support to member states when commercial flights halted. To date, our lab has tested over 22,000 samples and remains ready to support as required. But a pandemic this complex must be managed in a collaborative, coordinated, and calculated manner. The most effective collaboration has been the technical interplay between the chief medical officers, the political collaboration of the ministers of health, and the whole of CARICOM regional leadership of the CARICOM heads, with the two latter facilitated through the CARICOM secretariat's convening power. The CARICOM heads of government at this time have exercised tremendous leadership in the response to the COVID-19 pandemic. Individually, the heads engage their communities from the man in the street to the national level, pulling government sectors, unions, and the private sector together to the forefront of the response. At the regional level, the Conference of Heads, led by then Chair the Honorable Mia Motley of Barbados and now the Honorable Ralph Gonzalez of St. Vincent and the Grenadines, have mandated a common approach for the CARICOM states and mandated the elaboration of a common public health protocol for the region. The heads have signaled the imperative of coordination in procurement and distribution of COVID supplies, and most recently have approved the requirements for our CARICOM travel bubble. The CARICOM heads of government did not forget the community leaders and civil society organizations as part of the strategy to involve citizens and give them a voice at the decision-making table, and the public has responded accordingly. I well remember the issue of masks for the general public. In the Caribbean, I witnessed what I call a human experiment. Masks were judged to be useful, then a fashion statement. I will always see this CARICOM compliance with mask wearing as an outcome of the head's focus on community involvement and the ownership taken by the CARICOM citizens. This pandemic has been described as a marathon being run at sprint speed. CARICOM has responded to move swiftly to save lives while preserving the best of our cultural and societal peculiarities in order to maintain life and livelihoods. We used this opportunity to show the rest of the world that despite our small size and under-resourced healthcare systems, we have the ability to survive unrelenting adversity. To contain disease spread in the region, actions which were guided by the evidence presented have been the norm. CARPHA continues to advocate for the relevant authorities at the national level to follow the science. I thank OAS for this opportunity to spread the CARICOM message of whole of society and whole of region coordination for responding to crises. The decisions taken by our leaders have all been done to safeguard lives, manage risk, while continuing to coexist safely with COVID-19. Thank you.
Thank you so much, Dr. St. John. I will now go ahead and open the floor for discussion, and we have some questions from the audience. So the first question we have here, it says, In countries or regions where government financial support for people who have lost employment due to COVID has been adopted, was it a federal government responsibility policy or a subnational one?
Thank you. So in the Caribbean, the arrangement has not been legislated or consistent, and it has not necessarily been in the domain of the governments either. There has been private sector support to certain communities as well. But in the governments that have extended assistance, there has been a range, and it's usually been at the national level. The Caribbean countries are very small. So it's usually been a range of assistance, including an ad hoc support given out by constituents. So it is more of a political process rather than a national social security safety net. We have seen as well the suspension of IMF programs in order for governments to be able to afford to support citizens, or even just simply to maintain persons in jobs. Because what they have done in the Caribbean is that they have tried to minimize job loss rather than to allow jobs to be lost and then put on a support system. So thank you.
Thank you, Dr. St. John.